minutitos más, por favor. Les agradezco la paciencia que estamos ahorita esperando más a nuestra intérprete para el día de hoy. Gracias. Okay, everyone. Well, welcome again to another Ask the Expert with Face-to-Face. Just for sake of time, I'm going to get started. The slides are in English and Spanish if our Spanish speakers want to kind of go along with what I'm saying in the quick intro slides. Otra vez, bienvenidos a todos a otra Pregúntale al Experto para cara a cara. Mi nombre es Saraí, soy la coordinadora de la Universidad de Padres. Bienvenidos a otra sesión. Vamos a esperar otros minutitos mientras hago nuestra introducción. En la pantalla va a ver en español e inglés si quieres seguir con nosotros mientras seguimos esperando a nuestra intérprete que entre. Pero otra vez, muchísimas gracias por estar aquí con nosotros el día de hoy. Again, everyone, thank you so much for being here on another Ask the Expert with Face-to-Face. My name is Sarah E. I am a program coordinator for Parent University, and I'm really glad that you all are here with me today. So before we start today's session, just some quick norms. So this session will be recorded. We want to make sure that we are able to share this knowledge with parents that were unable to attend today. Please make sure you click that link in the bio. That's going to be our YouTube channel where you can find this session and many others that we've had since 2020. So we will have a presentation followed by a conversation with Dr. Christopher and also Cassie. The chat will be open to ask any questions that you may have, and we'll get towards the end of the presentation. But please keep in mind that we may not be able to get through all the questions, but we will sure do our best. Please be respectful with your comments, and please sign up for our newsletter, and you can also find that link in the chat. Once again, everyone, welcome to another Ask the Expert. Today we have COVID-19 vaccines with Erie Family Health Centers, and then also our Office of Student Health and Wellness. Thank you so much for being here with us today. Today we have Dr. Benavente and Cassandra. Thank you so much, both of you, for coming today and giving us this wonderful information. I know our parents still have a bunch of questions. This is still so much new going on. So I appreciate it. And whenever you are ready to start.
Yeah, thanks for having me. It's a pleasure to be here. Like Sarai said, I'm a family doctor. I work at Erie Family Health Centers down in Humboldt Park. I also take call and work up at Swedish Hospital. Nothing I didn't put in my bio. I'm a faculty in the residency program for Northwestern University Family Medicine residency. So I have a lot of jobs and I've had a lot of experience taking care of patients with COVID all across the spectrum, all across the ages. So this is really great to work with families and work with CPS on this.
Hi everyone, my name is Cassandra. I go by Cassie. I'm one of the Children and Family Benefits Unit Coordinator within the Office of Student Health and Wellness. I work on the far north side. In this role, we help engage, utilize, and enroll our families into benefits. I also am a Master's Social Work, and I got back from UIC in 2016. So we're really happy to be here and talk about the COVID-19 vaccine and how you might be able to access it as well as other medical benefits you might be able to get.
Perfect. Thank you both very much. Sorry, very quickly, our interpreter is in. Let me just get quick instructions for everyone to get into the Spanish channel. Ya llegó nuestra intérprete Leti. Por favor, si ocupa interpretación al español, hágale clic al icono del mundo que está en la parte inferior de su pantalla y escoja el canal de español para poder escuchar la presentación del día de hoy al español. Muchísimas gracias. Thank you so much, Cassie. Whenever you're ready to get started.
Okay. So we're going to go ahead and get started. Just so you know how the setup will go, we'll briefly talk about COVID-19 and the reasons why people in Chicago public schools have given us for getting the COVID-19 vaccine. And then I will turn it over to Dr. Benavente. He'll kind of talk to you about the COVID-19 vaccine as well and COVID, answer some questions you might have. He will have to end at 3:45 so that we can finish the presentation. I'll come back in, I'll close it out with talking about if you do decide to get the COVID-19 vaccine, where you can get the COVID-19 vaccine at that point in time, and answer any lingering questions that might have that are non-medical, as that's to be answered by a medical doctor. So again, today's goals, we're going to talk about COVID-19 vaccines in children and Chicago public schools, the reasons that our audiences have given us for why they would want to get the COVID-19 vaccine. We're going to talk to Dr. Benavente, and then we're going to talk about making the plan. So what are some of the reasons Chicago public schools has talked to our audiences about why some of the reasons they've decided to get the COVID-19 vaccine? One reason is that people feel that it's safe. They feel that it's effective. They feel that it's freely available to them. And they do feel that it's life-saving, that will prevent them from going to the hospital if they do, for some reason, develop COVID-19. When we specifically talk to our audiences about why they might want to get the COVID-19 vaccine, these are some of the most common reasons we're hearing. We're hearing that they know that their vaccinated children will not have to quarantine as long as they're feeling okay. So if there is, heaven forbid, an exposure in their classroom to COVID-19, their student will, to the next point, not have to isolate, not have to quarantine. This means that there'll be less disruption to the child's learning, meaning they can be in school and meaning they can be around their friends so long as they're feeling well and so long as their friends are feeling well. Another reason that we've heard from parents is to protect themselves from the virus, right? We know that getting the COVID-19 vaccine, it decreases the risk of getting COVID-19 vaccines. They want to protect themselves, but to go even further upon that, we've heard from parents and from students that they want to not only protect themselves, they want to protect their friends, their family, their grandparents comes up a lot, their siblings, their classmates. This comes up a lot, particularly around the holidays. Spring break is coming up. People want to see their friends. People want to see their grandparents that they haven't been able to see. So we've heard a lot about why I'm getting the COVID-19 vaccine now. I want, when we're going on vacation, to feel safe, to see my friends, to not worry that I'm going to get my grandma and my grandpa sick. So this is what we're hearing from our community about why they want to get the COVID-19 vaccine. And so just so you know, kind of where we stand with Chicago public schools and the COVID-19 vaccine, this is as of March 28th, 2022. This is kind of our percentage of what we're looking at for COVID-19 vaccines in Chicago public schools. So you can read this graph a little bit better. The dark blue areas, that's where more people have been vaccinated. The lighter the area, the less vaccination we have percentage wise. So we still have a long way to go, but we do see certain areas of the city are starting to get more and more vaccinated as it becomes more available. So we still have a ways to go. We're still providing vaccination clinics to our students, but this is where we currently stand. Another point really quickly to make, I don't want to take too long away from the good doctor, fully vaccinated means they have both their vaccinations, if it's not the one shot, and that they're 2 weeks post-vaccination. So that's where we're talking about with the fully vaccinated students. So now, the main event, where we're all waiting for, right? We want to talk to the expert. So I'm going to turn it over to Dr. Christopher Benavente. He's with Erie Family Health Center. We're going to switch up the slides. He's going to be able to talk, and we'll give him some time for you guys to ask some questions as well. Okay, so turn it over to you.
Great, thanks, Cassie. I appreciate that. I can just go ahead and share the slides over here. So these are some slides that were put together that I think are a good starting point for our conversation, but really are just meant to stimulate conversation. So as things come up, please put them in the chat and we'll be able to address those questions and concerns as we move along, or maybe at the end there. There's a lot of word salad that goes around when we're talking about COVID-19. It's also known as coronavirus. You'll hear SARS-CoV-2 as described by a lot of the scientific and medical community. Then you'll hear people talking about variants, Alpha, Delta, Beta, Omicron. Most recently, you'll hear people talking about BA2, all talking about the same thing. We're talking about the disease COVID-19 and your risk for getting it. It's been about 2 years, and we're still talking to people to make sure everyone knows what the symptoms of COVID-19 can and can't be. And it's a really long list, including some people who have no symptoms at all. This is one of the reasons why this condition is really hard to, why this virus is really hard to fight, is because a number of people are transmitting the virus among themselves and among family members without even knowing it. And there's a long list of symptoms that think that anyone who's not feeling well should be asking themselves, am I at risk of being positive for COVID-19? We do know that COVID-19 is still spreading. We are lucky to be in a season right now when it is less common than it was just a few months ago, but it is not gone. Anyone who says it's gone, well, let's say we'll have a difference of opinion, because we know it's something that we're still dealing with even today. And we know that children are getting COVID-19 too. In the very beginning of the pandemic in early 2020, in the spring and summer, the likelihood that a child came down with COVID-19 was lower here. And this graph here, if you can tell the difference between the color lines, you can see that these are age groups from 0 to 4, 5 to 11, 12 to 17, 18 to 22. You can see that the age group that was least likely to get it in the early part of the pandemic was the blue line here. And you can see those numbers really didn't rise very much until we got into the fall and winter of this last year. The group most likely to get COVID-19 in young people, so 22 and less, were the older ones. And so you might look at the first year of the pandemic and say that, actually kids don't get COVID. But what you can see here is that once schools started opening back up here in Illinois, it actually flipped, and that the group that had the highest rates of COVID-19 infection during the Omicron surge, which was just this fall and winter, were the school-age children 5 to 11, who coincidentally are the least likely to be vaccinated these days. We know the vaccines first became available to this age group in the fall. So we've been learning a lot of things as the pandemic has progressed. This is just to show that even as children do generally quite well with COVID-19, they don't have as many severe outcomes as older people. They do go to the hospital and they do need to seek care, and is still an illness that people are really concerned about. And so throughout the Delta surge of the summer and the Omicron surge of the fall and winter, the hospitalizations were lowest among youth who are fully vaccinated. So the best way that children and families can protect themselves against COVID-19 is with vaccination. We know that everyone is at risk for COVID-19. People who are at the most risk for severe disease are people who are 65 and older, and really anybody of any age. I'll say it again, of any age with certain medical conditions. Conditions can be really severe issues like heart disease, strokes, cancers, certain genetic conditions, to things that are as common as chronic lung diseases like asthma or people who have overweight or obesity. And even our young healthy people who find themselves to be pregnant, they're actually at risk for severe disease from COVID-19. You may hear these terms thrown around as well. MIS-C is a delayed complication from COVID-19, and it's seen exclusively in children. It does cause really severe organ problems, kidney failure, heart problems. Most children do okay after that, but it can be a really severe condition. And then I know in the news a lot lately, people have been talking about long COVID, where people, regardless of how severe their initial infection may or may not have been, they may continue to have some symptoms for weeks to months after the initial infection. So we always have to ask ourselves what we can do to prevent acquiring COVID-19 and prevent complications. In order, it's vaccinate you and your family, wear masks and follow isolation recommendations, do the testing that we now have more access to, and distance as is appropriate. It's kind of complicated knowing what it means to be up to date with your COVID-19 vaccines. It really depends on what kind of vaccine you got, when you got it, who you are, what your medical history is. It's fairly complicated. You'll hear things about boosters, you'll hear things about additional doses. If you do the math right, some people might end up with 4 or 5 doses of a COVID-19 vaccine to be considered up to date with their vaccination status. All this is to say, it's complicated. Talk to your doctor. If you have questions about whether or not you would benefit from one more COVID-19 vaccine, please have that conversation with your doctor. And if you don't have a doctor, you can come and see any number of the community health centers here in Chicago. There's a lot of us out there. I work at Erie Family Health Centers. This is by no means an advertisement, but I want you to know that there are a lot of really great healthcare providers in the city of Chicago who want to help you with these types of issues, because public health is everyone's health. As such, we know that, just like we were looking at earlier with Cassie, that there are certain areas in the city and certain groups of people that are more likely to have been what we call early adopters of vaccines, and there's certain groups in certain locations that are less likely to have been fully vaccinated. So we know that our families from Asian non-Latinx neighborhoods are more likely to have a complete vaccination series. And then it varies among ethnic groups as well as geographically, as we saw earlier. So some common questions that people will present about COVID-19 vaccines. I'm just going to flip through these because I really want to hear what your questions are. But the vaccines are safe. Some of these we'll address, what we'll refer to as vaccine myths. It is not really a new technology. It's been around for a long, long time. Lots of state, federal, and international bodies say that the vaccines are safe. They've been really, really well studied. The COVID-19 vaccine doesn't do anything to your DNA, doesn't cause any mutations to your cells or anything like that. How they work, it's kind of exciting if you get excited about science things, but again, it's kind of complicated. Then again, a lot of vaccines we don't often talk about how they work, but they work in actually really similar ways. COVID-19 vaccine, what it essentially does is it trains your body to recognize an infection and prepare itself, do a dress rehearsal for when an infection presents itself to you. Yeah, no long-term side effects have been observed. Anyone who has significant side effects, we're talking pain at the injection site, maybe a fever or headache, those are gone within just a few days. At most, people are laid up and maybe not able to work or go to school for a very short period of time. There's a lot of great resources out there to talk about the COVID-19 vaccines, to break down what are the facts and what are the myths about the vaccine. And it's really important that we're honest with each other and sharing that kind of information. There's a lot of misinformation out there about the safety of the vaccine in pregnancy. Every major medical society supports the use of COVID-19 vaccine in pregnancy. It's one way we can provide protection against a really vulnerable group of people. Lots of reasons to vaccinate, some of which Cassie was sharing with us earlier, and those are the things that I'm really interested in hearing what you all want to know about why you may or may not be interested in getting vaccinated. Yeah, right now vaccines are free. This is a big deal. Where I work in a community health center, before the COVID-19 pandemic, a lot of vaccinations were not free for my patients and families who maybe don't have health insurance. Getting access to adult vaccines was sometimes challenging and costly. This is one of the first times when someone could walk into a health center or walk into a pharmacy, and regardless of their ability to pay, would be able to receive a really valuable access to healthcare. And so right now, the government is offering this important healthcare service free of charge. And there's lots of really innovative and neat ways that those vaccines can be brought to you. There are home vaccination projects that I'm sure Cassie's going to be talking about, and lots of reasons to do this now. Okay, let's get past this as well. There's lots of really good information out there as well about the differences between the various types of masks that we all have access to. In the beginning, we were talking about using cloth masks. It's generally recommended that you wear a surgical mask or an N95 or a KN95, which are some of the higher filtration or higher quality masks, but really any mask is better than no mask. The different types of tests available can be a little bit complicated. We have home tests, which are typically called antigen tests or rapid tests. There are some PCR tests available. They typically can't do those in the home setting. Some of them are rapid, some of them are not rapid. Again, these are great questions to bring up with a healthcare provider. Washing your hands is important, if not just for COVID, but for all kinds of viral illnesses. And it still continues to apply for COVID-19. And that's where I'll stop. I just wanted to thank everyone for giving me the chance to share about this important topic. I'm gonna go ahead and stop sharing.
Much.
Of course.
So we did have a couple of people drop me some questions. If you're okay with me reading them out to you.
Sure.
So one of the questions that we have is a parent stating that their child does have a medical condition, epilepsy, and they're kind of concerned about, should they be giving them the COVID-19 vaccine? Should they be giving them the medicine for epilepsy? Like, kind of just wondering if there's anything they should be aware of with the condition of epilepsy and the COVID-19 vaccine.
Yeah, I think that's that specific and that general question about how specific medical conditions affect the safety of vaccine. I've answered that dozens of times in the last year, maybe even 100 times in the last year. And the short version is please vaccinate everyone and anyone who has a medical condition that might make them at higher risk. The medications that we would be concerned about related to safety around the vaccine, it's a really, really short list. It's a really, really short list. They include things like chemotherapy. They include things like immune suppressants. Generally speaking, there aren't any epilepsy medications that would be on that list. If you have specific questions about how a medication might be safe or not safe around the COVID-19 vaccines, of which there are at least 3 available for adults and 1 of them available for children. That's something you should bring up with one of your child's healthcare providers. I know I can state with confidence that all of your kids' doctors are excited to talk to you about this. The short answer is, though, they're going to say, yes, absolutely, you should vaccinate your child. There may be some recommendations about how to adjust medications around the date of the vaccine, but the short answer is yes, please vaccinate.
Okay, great. Thank you so much. And then another question that we had come in was they had heard some conversations around how do they trying to figure out how to the question what they put. Basically, they're hearing concerns about heart conditions with some of the COVID-19 vaccines, and just kind of wondering if you've heard of that and what your experience is, and do you still feel it's safe to get vaccinated, knowing that there is a certain population that does tend to get this heart condition?
Yeah, so that heart condition is called myocarditis, and what that is a inflammation of the heart muscle. That was seen in the trials for adults in very, very small numbers. It was seen in the trials for 12 to 17-year-olds specifically in very, very small numbers. It was not seen at all in the clinical trials for children 5 to 11. I'll say it one more time. There were 0 cases of myocarditis in the scientific studies that were done to approve the vaccine in 5 to 11-year-olds. The details are a little bit complicated and really even out of my range of understanding, but myocarditis is inflammation of the heart muscle. It was seen in some adolescents, but not seen in younger children. And actually, I'm going to share one more thing real quick here that attends to this exactly. When these trials came out, there was a lot of talk about that, and these numbers are talked about right here. Teens who received the COVID-19 vaccine, there were about 50 cases per million doses, 50 cases of myocarditis per million doses of COVID-19 vaccine, and 12 cases in girls, so 50 and 12 per million. So it's a little bit more than 1 in a million, right? That's for the vaccine. In the disease, it was 500 to 3,000 cases of myocarditis. So what that basically means is that if you're concerned about myocarditis, you should absolutely vaccinate your children, because the disease is 10 to 60 times more likely to cause myocarditis than the vaccine is. So if you're worried about heart conditions affecting your children around COVID-19 pandemic, the vaccine is more likely to protect than to harm. And that's really the best way that you can prevent the condition. There's conversation about whether or not the second dose should be delayed as opposed to the first dose. I think, again, that's a conversation that you should have with your child's healthcare provider, talking about the nuances that may apply to your specific child. But again, in general, the short answer is going to be vaccinate.
Great, thank you so much. And I think that's a really good point to make, right? That even COVID-19 runs the risk of getting that heart condition, and you're much more likely to get it. And I think that's not nearly talked about enough. So thank you. We had a couple more drop in the chat. Let's see here. So it was asked, what are your opinions or your thoughts around COVID-19, the shot becoming very similar to the flu shot? Do you think this is something we're going to have to continuously get? Should we be getting the boosters? And kind of that conversation around, how many shots am I supposed to be getting at this point? How often am I going to get these shots?
Yeah, the seasonality is an interesting question. I think that it makes sense for the flu shot to be thought of as seasonal, because the flu has a seasonality to it. We know in medicine that the flu tends to peak in the winter and fade away in the spring. We don't really see flu in the late spring and summer. It just is incredibly rare, to the point where we actually don't even test a lot of people for flu during the spring and summer. COVID hasn't done that. We've had surges in 3 out of 4 seasons of the year. Delta was even peaking at the end of the summer last year. So there really hasn't been a season off from COVID this year. So we can't really quite say that it's going to be a seasonal disease just yet. That might be the case one day, but as such, that's why it looks like in my opinion, that's why it looks like the boosters are being offered so frequently. Is because we haven't quite gotten to a seasonal rhythm yet. It might be that one day that it does become a condition that only flares in the winter, only flares in the fall, and the boosters might be recommended before that starts. But we haven't gotten there yet. Whether someone should be getting a fourth or a fifth vaccine, I think really remains to be seen. Most people are recommended to get the initial series of 2 shots and then 1 booster. We just heard last week or the week before that older people and people with certain medical conditions are recommended to get a 4th shot. But the biggest benefit is really from the initial series, from the first two doses. So if you haven't had your first 2 doses of any of the COVID-19 vaccines, I would really strongly encourage you to consider that.
Great, thank you. We have another question. The question is actually around the development of vaccines for children 0 to 5. They want to know if you've heard anything about how close we are and what that might look like for 0 to 5.
Yeah, so the Pfizer vaccine was the first one to be submitted for 0 to 5, and that was actually the very first disappointing trial for what we call the mRNA vaccines. That was the application was declined by the FDA in January, and that was really unfortunate. I think there were a lot of families who were really disappointed by that news. As such, that trial is ongoing. They're redoing more trials as we speak with a different dose of the vaccine to see if a more effective response is going to be possible with a higher dose. The Moderna vaccine is currently wrapping up its trial, and I believe the information has been submitted to the FDA for approval. Hopefully, from what I'm hearing in the news, is that sometime in the next 1 to 2 months we might have some more information about that. But I don't have any specifically privileged information about that. I'm right there with you. I have a child under 5 who I would really love to be able to offer vaccine to, because I think that we're all really worried about the most vulnerable people in our lives, whether those are the older people in our families or the youngest people in our families. We want to protect everyone as much as we can.
Thank you. And as disappointing as, Pfizer not getting past the FDA, that also speaks to the rigorousness, right? Not everything just gets passed. You do have to meet a certain threshold. So it does also still speak to, even though they are emergency authorization uses, they're still going through the FDA process. So while it's disappointing, it can also sometimes be reassuring for parents to hear that they're not just letting anything through. So thank you for that.
Absolutely.
Next question that we have is, why are children under the age of 18 only allowed to get vaccinated with a Pfizer vaccine versus like Moderna, Johnson & Johnson?
Yeah, that's really only because the Pfizer, the company, they asked for permission. That's it. When they did their initial trials, they studied the full dose adult dose vaccine in 16 and older. And Moderna just decided to do it in 18 and older. That's it. They just made that decision. And it happened to work in everybody of all ages, 16 and up. And so they adjusted the dose and applied for 12 to 16 and did it again. And so they just were the first company to do that. And Moderna just was a little bit farther behind in doing that. And as such, that they haven't requested for, before right now, they haven't requested for adolescents and 5 to 11s, but that's what they're doing right now. Yeah, there's no particular reason. They essentially use the same technology and essentially are using the same vaccine, just of different doses. We expect that to change as Moderna gets different age groups and different doses approved, but it's really just a result of what they asked permission for.
Okay. We have a question that came through in Spanish. I can kind of understand it. You might be able to understand it a little bit better. But from my understanding, it's basically saying, I don't know if this question has been asked yet, but I'm wondering if you can talk about how the vaccine affects children that have autism.
Yeah, eso es una buena pregunta. Así que no tenemos ni una razón para pensar que la vacuna tiene un efecto diferente o distinto en los niños con autismo. Tampoco pensamos que el COVID-19 es más feo, más peor en ese grupo de niños, debido a lo que todo yo conozco acerca de esa condición y la vacuna. El efecto y el beneficio es lo mismo. We have no reason to think that the vaccine has a different effect in children with autism. We expect it to be the same. Similarly, COVID-19 doesn't seem to have a different effect a different severity in children with autism. That being said, autism itself is a really broad spectrum condition. There's some children who have speech problems with autism. There's some children who have significant developmental delays, difficulty speaking, difficulty understanding and learning, and that may affect their health overall, but generally speaking, the effects should be the same with the vaccine.
Great, thank you. And thank you for asking that question. I think that comes up a lot, right? The concern of the link between vaccines and autism. We had another question. Is it true that pregnant individuals who are vaccinated can pass the antibodies on to the baby?
Yeah, that is true. And generally that's thought of as a positive thing, because antibodies of all different kinds get passed from mother to fetus, mother to baby during the pregnancy. The placenta does a great job of filtering out some things and passes other things along. Antibodies are just one of them. So antibodies that a pregnant person develops in response to a vaccine will often pass the placenta and provide protection to the infant to a degree. There are studies out there showing that COVID-19 and antibodies to COVID-19 that come from vaccination show up in breast milk. They show up in the baby's blood after birth, and they provide some degree of protection. And that's been the case actually with the flu vaccine going back years. That's been the case with the tetanus vaccine going back years. We think of it as a benefit. The antibodies that a pregnant person gets from a COVID-19 infection also pass the placenta. So not getting a vaccine, but instead getting the infection doesn't actually offer more, doesn't decrease the chance that the fetus will be exposed to antibodies.
Okay, great. Thank you for that. And so it sounds like there's a lot of benefits for someone who is pregnant to get vaccinated, because it'll also keep that newborn safe, which we know, correct me if I'm wrong, doctor, but I believe that the first year, they don't really have an immune system at that point in time, correct?
Yeah, I mean, for the most part, newborn babies are building from scratch. That's why we encourage vaccination during pregnancy. So babies get what's called passive immunity, where they get some of mom's antibodies passed through the placenta. We encourage breastfeeding because some of mom's antibodies pass through the breast milk and help to coat the baby's mouth and intestines to prevent infections passing on that way. Yeah, anticuerpos, really good for everybody.
Okay, good. Thank you so much.
Of course.
Wanting to be respectful as much as time, we've gone through all of our questions that I've gotten directly and been posted publicly in the chat. We are getting close to the time anyways to wrap up with our Q&A session, but just wanted to give everyone the space. This is the last call. If anyone had any questions that you didn't feel was answered, if you want to have the last say, any questions now, please post it in the chat or, raise your hand.
I did want to put this up for anyone who wanted to do some screen grabs. These are just a handful of resources that I thought were helpful, authoritative, and non-biased. So COVID.gov is a brand new resource. It's hot off the press in the last week or two from the government. The federal government has promised to put information up here with regards to where you can get access to vaccines, where you can get access to the new medications that are available for adults who are affected with COVID-19, and free testing. So please check that out. And there's your QR code to get access to that. Chicago Public Schools has a really great website with on the ground information about school level data and ways to keep you and your children safe. This is where I work at Erie Family Health. We have a resource page for COVID. And just to show that I wasn't biased, this is another really great health center in Chicago, Oak Street Health. They have done a really amazing work pushing, disseminating vaccines and vaccine information in Chicago. They were one of the first vaccinators here in my neighborhood where I live. So I want to put these out there as really great resources for everyone to consider.
Perfect. And we'll just linger on this for just a little bit so people can take their time and grab stuff what they need to. Just really wanted to thank you for being here, answering our questions. We had a lot of actually really great questions. Really appreciate you taking the time and your honesty and the conversation. It was great talking with you. You're very easy to talk to and gave some great advice on the COVID-19 vaccine. So just really wanted to express our gratitude. We are going to still be here. We'll talk about where you can get the COVID-19 vaccines, but I do want to be respectful. I want to be respectful of your time and just appreciative as well. So thank you so much for coming.
Oh, thank you. This was really a pleasure, and thank you so much for making this important resource available to the community.
Okay, so now we're going to switch a little bit over, and we are going to talk about, now you have some information about the COVID-19 vaccine. So now let's talk about, if you decided you wanted to get the vaccine, where you can get this vaccine. There are a lot of different places. Dr. Benavente showed you a lot of places where you can get the COVID-19 vaccine. Erie Health Center can get it. You can get it with Chicago Public Schools. You can get it with your medical home. A medical home is just like your primary care doctor, where you would take your kids to anyways, a pediatrician. You can get them at health hubs. We'll explain what those are as well. CPS also is providing mobile services, mobile clinics, regional clinics. And there are also a lot of other options at vaccines.gov. So we'll just kind of talk about where now. I decided I feel much more comfortable getting the vaccine now. If you decided that, where can I go? What are my next steps? So first spot is your medical home. Medical homes, your primary care doctors, who you would regularly see anyways. Some of you might be saying, I don't know who my primary care doctor is, or they can't see me for a little bit. And so we might be able to reach out to, if you are on Medicaid, you can reach out to your MCO, your managed care organization. These are some options, some of the available MCOs, Blue Cross Blue Shields, County Care, Aetna, Molina, but basically what we're saying is reach out to your insurance provider. If you don't have a primary care physician, or you don't know who your primary care physician is, reach out to your insurance provider, because they will let you know, or if you don't have one selected, they can help you select a primary care provider moving forward. It's always good if you can go to a medical home to get vaccinated there, because they will be able to have some of those conversations that Dr. Benavente was talking about. I'm concerned that my child who has epilepsy, I'm concerned about this medication specifically they're taking. It's good to talk with your doctor about that beforehand. So going to your primary care physician, you can have those questions answered one-on-one, and you can also get the vaccine all in one appointment. So going to a medical home is a great option for getting the COVID-19 vaccine. There are also places called CPS health hubs, and we'll go over what those are. So basically what a health hub is within your school, it shows that there are a community-based health center within 1 to 2 miles of your school's campus, and these partner with Chicago Public Schools. Some of the health hubs are Access, Cook County, Esperanza, Miles Square. They are affordable, they're accessible, they're comprehensive, and they are CPS approved, meaning they partner with us. We know who these individuals are when we go to the clinics. So comprehensive just means that you could go to a health hub, and you can also go there for your primary care as well. So if you do call your insurance and you say, I don't have a primary care doctor, you can continue to go to the health hub if you become a member with them. But they are also an option available for you. One One second. We do have some community-based health hub partners, Cook County Health, UI Health, Access Health, Esperanza, we just talked about. We know that they're located within 1 to 2 miles between our schools. If you don't know who your health hub is, or if your school is connected to a health hub, you are more than welcome to give us a call on the Healthy CPS hotline. We'll share that information later as well. But just so you have it, that phone number is 773-553-5437, and we can see if you are connected to a health hub or what vaccination opportunities are available to you that are close to you. And that kind of leads us into the next point. Chicago Public Schools. There are vaccinations happening within Chicago Public Schools. They can happen at our clinics. So we have certain regional clinics. We have 4 regional clinics that happen Tuesday, Wednesday, Thursday, and Friday, same day every week. They're not happening next week because it's spring break. But they are always running at the same time. So you can go to a regional clinic and get booked on those days. There also are mobile events. Mobile events are when a clinic actually comes to a school. Not every school is having a mobile event every day of the week. So we do encourage you to look at what school in your area is having a mobile event, or you can give us a call at that phone number and we'll see what mobile events are happening near you. School-based health centers. So we do have a map on our CPS website where you can look and see if there is a school-based health center near you that is allowing for the COVID-19 vaccine to happen. Always be giving them a call beforehand because they might not have appointments available for the community at that point in time. If you have any questions about this, please reach out to us on the Healthy CPS hotline. This is what we do. So feel free to give us a call, say like, hey, I'm interested in the vaccine. I don't know where to go. Give us a call. We will be more than happy to help you figure out where you need to go, what works with you, and getting that appointment set up for you. And again, this is our hotline. So feel free to call us 773-553-5437. We can help you get connected with the vaccine at CPS. There are also places outside of CPS. If you say none of those days work for me, I really need a Saturday appointment, but CPS isn't providing a Saturday appointment, we can direct you to where outside of CPS there might be a Saturday appointment, or maybe that one week you do have a Saturday appointment happening at one of our health hubs. So feel free, give us a call at that phone number. You can also visit us at cps.edu/vaccinations. Also, you can email us at the Office of Student Health and Wellness, ohsw@cps.edu, with any questions you might have. You may also reach out to us as well for Medicaid and SNAP services. So if you're needing connected to benefits, yes, absolutely, I want the vaccine, but I don't have insurance. I don't have a primary care doctor because I can't pay to go to the doctor. We can assist you with that as well. So please just reach out to us, have a conversation with us. We'll answer everything to the best of our ability. We might refer you out to some other sources like an insurance company, a regional clinic, but please have a conversation with us. We are more than happy to fill whatever we can and direct you where you can.
Awesome, Cassie. Thank you so much for this information. I know there's still so much going on and there's so many questions with the COVID-19 vaccine, and I appreciate you bringing along also Dr. Buenavente to kind of ease those worries of parents a little bit and bring accurate information for our parents. So I really appreciate it. If there's any questions at this time for Cassie, please feel free to put those in the chat before we end today's Ask the Expert. I really appreciate everyone being here with us today and coming and, learning a little bit more and not completely dismissing the topic. So I really appreciate it, Cassie. Is there anything that you wanted to end off on? One big note to give to our parents before we end today's session?
Thing that I want to just echo really is we know that this is a big conversation, COVID-19 vaccines. We know that there's a lot of information you may want to gather before making the decision yes or no with the vaccine. We are here for it. We're here for it to have the conversation, to connect you with resources. We know it's a big decision about whether or not to get your child vaccinated. We appreciate you coming here and just hearing us out. That's a great first step, yes or no to the vaccine, but you came here and you got educated. So we really appreciate you coming here to ask your questions and to stay informed about the COVID-19 vaccine. There will be more of these as well. It might not be with face-to-face, it might be on your school level. There will be more education events as well. So if you have questions, you feel like you want to have another conversation, you can reach out to us. I dropped our phone number. I'll drop our email as well. Have conversations in the schools, have conversations with parents. Conversations are not a bad thing so long as they are informed conversations like we had today. So really appreciate you guys dropping by.
I think that's really well said, Cassie. I know taking that step to kind of change your mind or get more information to see if you change your mind is always a good step to take. So I appreciate you giving our parents this information and bringing along the doctor to kind of ease that a little bit. To everyone that joined us today for Ask the Expert, thank you so much for joining us. As Cassie mentioned, there's going to be more sessions coming up in Ask the Expert in relation to COVID-19. So please feel free to join us. That link is in the chat. For our YouTube page as well. Please feel free to go and check out our other videos that we've done and other sessions we've done for Ask the Expert and the rest of Face to Face. I hope everyone has a wonderful afternoon and thank you so much for being here. Take care, everyone.
Thank you. Bye.
Cassie.